Thank you for joining today's webinar. We'll begin momentarily. Once again, if you're just joining us, thank you for joining today's webinar. We'll begin momentarily, just letting folks trickle into the Zoom webinar. All right, in the interest of time, we'll go ahead and get started. So I'd like to welcome you to today's webinar, Connecting with Financial Help, Navigating the Total Assist Portal. I'm Maureen Island, Senior Director of Communications and Marketing at Patient Advocate Foundation. Before we get started, I want to share a few quick reminders. Today's webinar is for providers and pharmacies only. If you are a patient or caregiver, we ask that you register for our June 25th webinar taking place this Thursday. We'll go ahead and drop a link in the chat in just a few moments. So if you are a patient or caregiver, we recommend you use that link to go ahead and register. In addition, today's webinar is being recorded, and a recording will be shared along with slides and resources to everyone who registered. Please use the Q&A feature to submit your questions during the webinar, not the chat feature. We will try to answer as many questions as we can during our time together, but please note that we are unable to answer questions about individual grant information or medical situations. I'm also noticing several people are saying there's a bad echo. We recommend that you go ahead and check and see if you have two open windows of the Zoom webinar. Most likely that is the issue that's causing the echo. Please close one of those windows while you keep the other one open. That might help with the echo, but we'll also be troubleshooting on the back end. So thank you for letting us know. Finally, closed captioning is available via Zoom for those who may need it. And if you need technical support during today's webinar, please use the Zoom support link or message the host. During today's webinar, you'll be hearing from three of my Patient Advocate Foundation colleagues: Jennifer Brewster, Vice President of Financial Support Programs; Sarah Krusky, Senior Director of Financial Support Programs; and Brittany Stuber, our Senior Manager of Provider Program Outreach. As you'll see, we have a lot to cover today as we work to ensure you feel confident using the new TotalAssist portal beginning next week. First, we'll be giving you all a sneak preview of the TotalAssist.org website, and we'll walk you through how to sign up for our TotalAssist Fund notification system. Then we'll dive into the new TotalAssist portal and some of the key actions you can take within the portal itself. Next, we'll give a brief update on some enhancements coming to our FundFinder tool. And finally, we'll round out our time together sharing some helpful guides and resources, reviewing the TotalAssist launch timeline, and answering a few questions we received as part of today's registration process. And as a reminder, these slides, along with the webinar recording and other resources, will be shared with all registrants in the coming days. I'd now like to go ahead and introduce Jennifer Brewster, Vice President of Financial Support Programs, who will get us started.
Thank you so much, Maureen. We're really excited to show you the TotalAssist.org overview. Go ahead, next slide. All right, so this is our TotalAssist homepage that we're really excited to show and launch on July 1st. So as you can see, it's really easy access at the top for your portal login. So if you click the portal login button at the top, it's easy access to log into your patient, provider, or pharmacy portals. Also, just a little note, if you select the Apply Now button, you can also access your provider pharmacy portal. And we're really extremely excited to announce our quick eligibility checker. So this, if you answer a few brief questions about your patient, it really gives an really accurate information whether the patient would be eligible for a total assist fund or not within just 3 to 5 minutes. And this could be actually completed without logging into your Total Assist portal. So this is actually on that main web page and just takes about 3 to 5 minutes to see if they're, may be eligible for a fund. Next slide. All right, now we're at our Total Assist homepage and main menu, and you can select each menu topic to expand it. So for example, find your fund. You can search by disease or medication name to find your fund and check your eligibility. You can also, there's a link to apply online. And if you have any questions, you can call into the program and also get notified when funds are open. Next slide. All right, so now on the Total Assist homepage, find your fund. So you can use the search bar to enter in a disease name, medication, or ICD-10 code to actually search for funds that you're looking for to apply for your patient. You can also check to see if your patient is eligible for the fund. And then step 3, if the fund is open, of course, you would apply then for your patient. If the fund is closed, we encourage you to sign up for notifications when it opens, and that can be via text, email, or also an automated phone call. Next. All right, so now we're going to go over more information on our homepage, which is relative to our help center. So you can search our Total Assist Help Center for assistance or navigating specific topics that can include applying, verification, how to use the grant, claims and expenses, information regarding portal accounts. So an array of information is available in our search and our help center. And then just to highlight our quick tool, like a quick check-in tools to get key information without logging into the portal. So we will have a quick check available that doesn't require logging into the portal, where you can check the patient's grant balance, you can check their award amount, you can check the status of a claim, whether it's been paid or not, the payment information on that claim, and also patients can also activate their transportation card, Visa card, so they can start using that. And that's all can be done without you logging into the portal. Next slide. All right, so now we're going to move in signing up for Total Assist Fund notifications. Next slide. So Total Assist Fund notifications is also available at TotalAssist.org on the Notify. And first, you would select your fund. So you can choose to have one fund, you can choose to have all of the funds available. You can select as many as you would like. Next step, you would then select how you want to be notified. So text, email, and automated phone call are all options that you can select. And also you can manage your preference at any time by clicking the Manage Your Preference button at the bottom. So say you're signed up for text, but you really want to get an email instead, you can manage that preference at any time. So this is a really great tool to make sure that you sign up for those fund notifications, so you're getting that up-to-date information when funds are opening for your patients. Next slide. All right, moving ahead, getting started with the Total Assist provider and pharmacy portals. Next slide. So what's in a portal account? So wonderful news, you can log into your Total Assist portal 24/7. You can apply for new Total Assist grants for your patients, as well as renewal assistant grants for your patients. You can access your virtual pharmacy card information on behalf of your patients, submit claims and upload documents to patient accounts. You can check information like the approval status of whether a patient's approved or not, the up-to-date grant balances, as well as their eligibility dates for their approval, and their claim status, so whether a claim's been approved, denied, paid, and the dates of service. You can also access important documents and updates. So if, as we stated before, if you're needing the virtual pharmacy card or a copy of their approval packet, that information also is available in your portal account. Next slide. So we're going to highlight the login screen on portal.totalassist.org. So this is where you can log in or register for a Total Assist portal account. And highlighting again these quick action tools. So this requires no portal login. You can quickly check awards and claims information on the screen. You can also sign up for Total Assist fund notifications, as well as searching our help center for any questions you may have, and activating the travel visa card. Next slide. So highlighting information, we're going to talk about logging in for existing PAF CPR or PAN portal users. So this is if you have an existing portal account. So for PAF CPR portal users, you're going to use your CPR portal username, which is your email that you've used to register, and then the password to log in. So this will be the process also if you have both a PAF CPR and PAN portal account. So if you have both, if you have a CPR portal account and a PAN portal account, you will use your CPR portal information, your username and your password, to log into the Total Assist portal. For PAN portal users, you will have to update your password. So the process that you're going to do is you're going to hit forgot login or password. You're going to enter in your PAN portal username, which is your email, and then follow the prompts to reset your password on 7/1. Next slide, please. Now we're going to review understanding what legacy portal data migrates. So first we will highlight the PAF CPR portal data. So all active portal users that have logged in within the last 12 months will be migrated to the Total Assist portals. CPR data related to all active and expired patient grants will also be migrated. CPR claims that have been submitted prior to July 1st of 2026 will be visible based on the portal user rules. So for example, patients are going to be able to see all of their claims. Providers and pharmacies will only be able to see the claims that they submitted using their NPI into the program. So patients, again, will be able to see all their claims. Providers and pharmacies are only going to be able to see the claims that they submitted on behalf of the patient that is connected to the NPI. Now we're going to review the PAN portal data. So all active portal users that have logged in within the last 12 months will be migrated to the Total Assist portals. PAN data related to active patient grants currently active or have an enrollment date of January 1st, 2025 or later will also be migrated. PAN claims paid prior to July 1 will not be visible in the Total Assist portal. However, the patient grant balances will reflect that, the claims that have been paid out prior to July 1. So just to recap, the PAN claims will not be visible that were paid prior to July 1st, but all patients' balances will be accurate to what their current balance is for those claims paid prior to July 1. And if you would like to retain any grant details for additional patients, we really recommend saving this information before the PAN portal closes, which is on June 26th at 5:30 p.m. Eastern Standard Time. And if you need additional assistance or have any questions regarding that, please email us at providerhelp@patientadvocate.org. Next slide. So we're going to move into creating a new Total Assist portal account. So this is for any PAF, CPR, or PAN portal or user that you don't have an account at all. So you're brand new to Total Assist. Next slide. So creating a new Total Assist portal account. So beginning July 1, if you don't have an active PAF, CPR, or PAN Foundation portal account, you can sign up for a new Total Assist portal account in a few easy steps. So number one, you would visit the portal.totalassist.org, and we always recommend that you bookmark that page so that way it's really easy access to get back to, especially if you're going to be logging in and out often supporting your patients. Number two, you would find and click Create Your Account. Number three, you would select the type of user you are. So whether you're a provider or pharmacy, Just please make sure that you're selecting the correct selection. Number 4, follow the prompts and complete the required fields, then click register. Number 5, you'll receive a registration confirmation email with a link to confirm your portal account and verify your email. The link is valid only for 2 hours, and if you don't receive the email confirmation, please make sure that you do check your junk and spam folder because sometimes it does end up there. And number 6, at sign in, you'll be prompted to complete a multi-factor authentication. That being said, check your email and enter your unique code to access your account. And also on the portal login screen where the multi-factor authentication is, there is a little checkbox that states, remember my device for 30 days. If you select that little checkbox, then you won't have to multi-factor in every single time you log into the portal. Next slide. All right, so now we're going to head over and do an overview of main navigation and features for our portal. Next slide. So here's the portal home screen. This is a dashboard for a new account. So if you've just created a brand new account, you would see your recent activities and actions required as there's no actions found because you're brand new. So as you complete applications and submit claims, then data is going to populate into these sections. Next slide. So here, as I stated before on the previous slide, this is what a provider dashboard would look like if you already had an existing account. So recent activities are listed in reverse chronological order. So select View All to see all activities or required actions. You can also click View Details or Complete Action hyperlinks to view full activity details or complete required actions. So for looking at our recent activities, we can see that, we recently applied for Jane Smith and that she's in a pending status because if you look at the actions required, we need income information for Jane Smith. So if you select complete action, this is where you can upload her income documents and complete that action required. And you can see John Doe's activities, his application is approved. And then you can view the details for any additional information in recent activities that you may need. Next slide. So highlighting the applications tab. So application and grant award information can always be accessed in the applications tab of the portal. So the most recent application will always be listed first, and you can then use the search and filter button to locate a particular patient. And then to also, if you would like to view the full application information per patient, then you can view the application details. And as you can see on the application screen, you would have the patient's name, what their fund information is, their balance, their effective date, when they expire, and also provides the look back date. And again, if you drill into the view application details, you'll get additional information for the patient. Next slide. So now we're still on the applications tab, but we're going to review the search and filter features. So the search and filter button is a really great way to find patient applications and find them quickly. So you can search by their name, you can search by their date of birth, you can search by social security number or alien number. You can also search by fund, and you can also search by application status, so approved or expired if you're trying to really narrow down a subset of patients. And then you can apply filters. So you can filter by expiration dates and actions required. So maybe you want to really find out how many of your patients that you still need the diagnosis verification form or are missing income. These are some of the things that you can use the filter for. And then also you can filter by awards that may be revoked due to new, inactivity. So just as a reminder, you have to submit claims every 120 days for those patients that are approved. So this filter would be a good way to see if there's any ones that are in a revoked status or anyone that you need to submit claims for. Next slide. All right, so now we're going to review the claims tab. So the claims tab will display all claims submitted by users affiliated with your NPI that you registered with. You will not be able to see claims made by patients or other providers. So you would click the bold headings to sort claims by a particular column, and then you can also click the eye icon to view any detailed information that you're trying to view for the claim. So as you can see, some of the information, you have the patient's number, a check number if it was paid, amount submitted, amount paid, and what the status is in. So if it's denied, pending, or if it's in an approved status, all that information is available for you on the claims tab. Next slide. All right, so now we're going to review the patient search tab. So you use the patient search tab to search for an existing patient that is already connected to your account. And then you can also use the patient search tab to look up a patient that you would like to connect to your account. So internally, we call that linking. So you have the ability to actually search and also link the patient that may not be already associated to you in this patient search tab. So first, to begin a search, you would enter the patient's first and last name, or if you have the patient's patient ID for the program, you can also search by that as well. Next slide. And just to highlight our chat feature, so if you are needing any help while you're navigating in the portal, you can chat with a member of our support team that is during regular business hours. So that's Monday through Friday, 8:30 to 5:30 Eastern time. You would be able to be connected with a representative to chat any questions, and that is available right in the portal for you if you have any questions. Next slide. All right, now discussing connecting patients to your account. So we highlighted that a little bit on 2 slides ago. So next slide. All right, so connecting existing patients to your account. So first you would click on the patient search tab and enter in the patient's first and last name. Next step, if the patient is not connected to your account, it's going to prompt you to enter in their date of birth plus one of the following. So you would have to have the date of birth plus either the patient ID, social security number, or alien number. After you've input their information, click the patient search button. Once you click the patient search button, any matching patients will show at the bottom of the screen, and then you would be able to connect them to your account. Next slide. So this is continued from the previous slide. So connecting existing patients to your account. So after you've searched and you've entered in that criteria, then you can see, if the patient is already connected to your account, their basic demographic information is going to display for you, along with the list of related applications and actions. So you can see here that if there's any actions, their statuses, whether they're approved or expired. Next slide. And if the patient's not found, you will get a little red pop-up in the corner that says patient doesn't exist. And if your patient's not found, you'll receive an on-screen pop-up message as we just displayed in red. And then to generate a record for that patient, you could go ahead and move forward with creating an application, because once you've searched for them and nothing displays, then they do not have a record, and you would move forward with creating a record and an application for that patient. Next slide. All right, I am going to turn it over to Sarah Krusky, and she's going to move into applying for a TotalAssist grant for your patient.
Hi, good afternoon, everyone. I'm going to walk you through how to apply and how to how to navigate to the fund that you're applying your patient for. And I will also walk through the claims process. So applying for your patient, there are 6 sections to our application that we will go to in more detail on the upcoming slides. But one really great feature about our application process is that after submitting your applications, in most cases, you will get an instant decision that the patient has been approved, and the patient can begin using their TotalAssist grant right away. In order to start the application, navigate to the Applications tab and then click the Create Application button at the top of the screen. This will then prompt you to search for the patient account. Every time you're starting an application, The system does require a patient search. This is just to ensure that duplicate patient records are not accidentally created. Then the application will begin our pre-screen process. Here you will enter the patient's address and will ask you to verify their address. We have a verification system with all known postal addresses, and the system does attempt to verify. If we are unable to verify the address, you can still proceed and you'll see a message in red, like displayed on the screen here. And if the system is able to verify the address on file, you will get a green address verified, which is displayed here on this. But either way, you can continue with the application regardless if the system was able to verify the address. Next, you will select the patient's diagnosis from the drop-down menu, answer questions about their insurance, and then the fund that you are applying for on their behalf. Only funds that the patient is eligible for based on their address and zip code and their diagnosis and insurance status will display. So if they're eligible for a health equity fund, that would display based on their zip code. Then, once you hit next, the system will ask you to confirm the address again. Please confirm that the address entered is the address that matches the patient record in your system. And if it is, please hit confirm. And if not, you can hit continue editing to update that address. Then you will move to our pre-qualification section. These are questions that will populate based on the fund that you're applying for the patient. Answer these questions on the screen and then click Next. And after you've completed that, you'll receive a green pop-up in the upper right-hand corner of your screen. This message will be green if successful and red if not successful. A red message would mean the patient was not eligible for that fund based on the answer to the questions. Then you'll see the patient address again, but these details will pre-populate based off of the information you entered in the pre-screen process earlier. Then scroll down to enter the contact information and the additional information about the patient. This is all information related to the patient. One really great feature that we have is we have the preferred method of contact. You can select for the patient, either mail or email, how the patient prefers to receive communications about the program. It's a great way for patients to be able to receive documents very quickly. If your email is selected, if it's not, that's okay. We can mail them a copy of all of their documents. And also we have the preferred language of English or Spanish. If Spanish is selected, patients will receive communications in Spanish. Next is the applicant information section. This is the information about the person who is submitting the application on behalf of the patient. So this would be your information, your name and information. This is also what populates over to who's signing and attesting to the application on the patient's behalf. And then the referral section, this is just a drop-down menu of how the patient was referred to Patient Advocate Foundation's Total Assist program. Next section of the application is the authorized person section. If there is anyone who is authorized to speak on behalf of the patient, please check yes. This would be anyone, a patient caregiver, spouse, family, friend, someone who's authorized to speak on behalf of the patient or to ask questions. We can also send them duplicate copies of the patient's program communications if they are assisting them with their grant. After you finish this section, click Next. Then you'll move into the insurance section of the application. You'll answer questions in the policy details. You'll find their primary insurance carrier. If they're not in the list, in the drop-down list, simply type in the name of the insurance carrier to proceed. Then under the insurance info, there's a question asking if the patient has secondary insurance. If the patient has a secondary medical insurance, please select yes. And if not, leave it at no and click Next to continue. Then on the medical tab, you will search for the patient's treating provider by entering the search criteria into the blue box. You can do city, state, NPI, first name, last name, or zip code. Based on the search criteria that you enter, a list of treating providers will display. You can select, once you see the provider that you need to select as the patient's treating provider, click on it and it will highlight in blue. And then You can continue. Then there will be a pop-up that will ask you to select the address of the treating physician. We know that sometimes treating providers are in multiple locations and there may be multiple addresses. So you will select the address from the drop-down menu and click Submit. Then make sure to edit the contact details. Here you can edit the name, the phone number, fax number, email address, and then an extension if needed. Double check to make sure the fax number listed is correct. But please keep in mind, if you attest to the diagnosis during the application, we will not send a diagnosis verification form. This is only in cases we need to reach out to you if we were unable to verify the information based on what was provided on the medical tab, which we will go into detail in just a minute. Once the provider is selected in blue, click Next to continue. Then on the medical tab, this is where you'll enter all of the information relative to the patient's diagnosis. You'll enter their date of diagnosis, the medications that the patient is currently taking related to the diagnosis. However, if the patient was in treatment or still meets the criteria and is not currently taking a medication, you can select insurance if they're only seeking premium assistance. Finally, and then you'll answer questions regarding diagnosis and treatment. Does the patient have a confirmed diagnosis? And then you have the ability to attest to the patient's diagnosis. Now, this does work a little bit different between the provider and pharmacy portals, and we will go into that into detail. If you do not attest to the diagnosis verification form will be faxed to the fax number that you provided earlier. For provider portal users, if you're attesting to the diagnosis, the system will prompt you to enter the patient's diagnosis, their diagnosis ICD-10 code. You can enter the ICD-10 code, and relevant ICD-10 codes to this fund will populate. Once you've selected the correct one, the patient diagnosis, the description of the patient diagnosis will display. Once you've completed that, click Next to continue. For pharmacy portal users, you can also attest to the patient diagnosis. Once you've selected yes to confirming the diagnosis and attesting, you will also select the ICD-10 code relevant to the patient's diagnosis. And then you'll scroll down to upload diagnosis verification that is required for the application. For pharmacy portal users, there's always a list of acceptable documentation that is required for application submission. This can be a copy of electronic prescription, a copy of insurance prior authorization, a copy of the chart notes that show the provider diagnosis or ICD-10 code. You can upload those documents into the portal directly by either dragging and dropping files in, or you can click to select from your system to upload them. Once the document's been uploaded, you will see it below that it was successfully uploaded to your account. Once you see it there, click Next to continue. Then you'll be prompted to this is the authorization page. Review the patient agreement. And then the patient agreement will display. Check the boxes. These are attestations that must be agreed to in order to proceed with the application. Once you've read through them and you've checked the appropriate boxes, click yes to acknowledge that you have read and understood the patient agreement disclosures and attestations. Here, you can also opt the patient in or out of communications from the program. You can print the patient agreement, and then you can also sign and submit the application. Once you've done everything you need to do with the application, go ahead and hit sign and submit, and this will submit the application to us. Once you've submitted the application, the system will automatically bring you to our application screen. This will show you the status of the application. In most cases, you're going to receive an instant decision that the application was approved. In this section, you can also find the pharmacy card information, and we now have our TotalAssist claims guide located on this page to give you details about what needs to be submitted for each type of claim. You can also navigate to the Applications tab to view the application. You can view additional information regarding the balance. You can go here to submit claims quickly, view documents related to the patient account. This is where you can view the welcome packet and the approval letter that are sent, or any other letters that may have generated, say the patient's application where income was required. You can view them here, and then click on View Application Details to view the full application details. Once you're in the full application view of all of the details, all of the application information can be found under Award Info. You can also upload documents, review correspondence, view and submit claims, and access the pharmacy card from this view of the application. Next, we're going to walk through submitting and managing claims. As a reminder, the TotalAssist claim guide is located on the application tab in the individual patient's account on the application status pharmacy card tab. Submit a claim. There are 4 steps that need to be taken: providing claim information, selecting who the claim is payable to, uploading the supporting documentation, and signing the claim. You can submit claims in 2 ways. 1, navigate to the Claims tab and select Submit a Claim. Once you do that, the patient search will appear. Once you found your patient, you'll be able to complete the claim. You can also navigate and submit a claim from the Applications tab by navigating in the left-hand menu to the Claims tab and then click Submit a Claim. Once you've started your claim, the first thing you will do is select who the claim is payable to in the drop-down menu, whether it's the patient or guardian, if the patient's under 18, the provider, an insurance company, or other. Then the system will ask you for the relevant service information related to the claim. First, you'll search for the facility, provider, or insurance company. Once you've clicked into that box, the provider search will display. You'll search for the provider by entering the search criteria, as many as needed, to locate the provider record for whom you're submitting the claim. The list of facilities and providers matching your criteria will display. Once you've found the provider that the payment needs to go to or the insurance company, click on it. It will highlight in blue, and then click Next. Then on the Payable To screen, it will ask you to select the provider address. Again, we know providers sometimes have many addresses. There's a physical and a billing address. So select the appropriate address where the payment needs to be sent from this screen, and then click Next. Then the system will prompt you to upload the supporting documentation for the claim. Again, the TotalAssist claim guide is located in the portal and is a great guide to see what is required for each type of claim that can be submitted to the program. To upload documents, you can drag and drop into the outline box or click it to select files from your computer. The successfully uploaded documents will display here. Once completed, click Next. Then the system will ask you to review and sign the attestation. You'll type your name into the e-signature box and click Sign and Submit. Once you've clicked Sign and Submit, the portal will take you back to your dashboard, and you will receive a green notification if the claim was submitted successfully, and if it wasn't, you would receive a red message. You can also, from the Claims tab, review all of the claims that you have submitted on behalf of patients. Navigate to the Claims tab and then click, and you'll be able to see the full list. All claims connected to your NPI number will be listed. You can view the details of a claim by clicking the eye icon under the Action column. Once you open the screen, this is the POE. You'll be able to see the amount paid, the date of service paid, check number, and the date the claim was paid. The left-hand side, you'll also be able to see denial reasons if applicable, who it was paid to, and then the attachments you submitted for that particular claim. And thank you guys so much. And with that, I'm going to hand you over to Brittany Stuber, our Senior Manager of Provider Program Outreach.
Thank you so much, Sarah.
As we mentioned at the top of the presentation, and Sarah just mentioned, I'm Brittany Stuber. Now that you have a full understanding of how to apply for grants in the Total Assist portal and begin making those claims, I'm going to cover some of the other workflows and activities you'll be using the portal to complete. First, we'll walk through renewing a Total Assist grant. Renewing a grant in the portal is quick and easy. You can renew a patient's Total Assist grant beginning the day after their current grant expires. In the Applications tab, you'll recognize expired grants by their color and their label. They'll be orange color at the top, as you see kind of here in the call out box, with a label in that upper right-hand corner that reads expired. A quick tip here for quickly finding expired grants. Make sure to use that search and filter buttons in the upper corner, and you can select options to only see grants that have recently expired or will be expiring soon. All right, so you've seen which patients are eligible for renewal by waiting until the day after their current grant expired. What's next? To renew the grant, you're just going to follow the exact same process and steps as you did when you were applying for a new grant. Navigate to the Applications tab, click Create Application, search for your patient, and then follow the prompts to complete the application. Because renewal patients are already going to exist in our program, some of that demographic data will auto-populate into the relevant fields. That will make those renewal applications a bit faster to complete than if you were to apply for a new grant for a brand new patient. A final tip here, before you begin that renewal application, don't forget to check TotalAssist.org to see if that fund is open. Now that we've covered renewals, let's talk about accessing additional funding for your patient. Just like renewals, we've worked to make accessing additional funding fast and easy for you. Here at the Patient Advocate Foundation, we operate under what we call a guaranteed grant model. Their initial award or the guaranteed amount is designed to cover 100% of out-of-pocket costs for most patients within that covered disease state. However, we know that depending on their insurance coverage and other details, some patients will need additional assistance and resources to cover their annual out-of-pocket costs. In that case, if your patient uses their initial guaranteed grant amount before the end of their 12-month eligibility period, they may automatically receive additional funding from what's called the unguaranteed portion of their award. This is always based on the availability of funding. To access that unguaranteed additional funding for a grant, all you or your patient has to do is submit a claim of any type. If funds are available, we're just going to automatically award those unguaranteed funds to cover additional expenses up to that maximum award amount for the fund. There's no need for the patient or you as a provider or a pharmacy team member to make a call to the program or to apply for additional funding to access any of this additional support. Let's put this concept in action by using a quick example. The Total Assist Breast Cancer Fund that you see off on that left-hand side, or right-hand side, excuse me, guarantees that all patients are going to have $3,500 for that eligible expense related to their breast cancer diagnosis. And if their needs go beyond that amount before the grant expires, say they've used $3,400 of that amount and then get a bill for an in-office infusion treatment that was $500. What they're going to do is simply make a claim for that full $500, or you can make a claim on their behalf. If funds are available, we'll cover that additional expenditure from the unguaranteed portion of their grant. Not only that, but we'll cover other additional expenses up to a total award amount of $6,500 that you see there. And then again, to access those unguaranteed funds for additional expenses, you or they simply have to submit a claim. If you want to check out a full list of our funds with grant assistance amounts, head over to TotalAssist.org. All right, next I want to cover some big news that we teased in our previous webinar, FundFinder 2.0. If you're not familiar with our FundFinder tool, it was created to stay on top of fund openings, not only at our organization, but at all 8 charitable assistance foundations that offer financial assistance for patients. Launching on July 1, our new and improved tool is going to offer some upgrades to cover up and over the original version that we had. So in addition to seeing funds across all 8 of those charitable nonprofits, FundFinder 2.0 is going to have a more user-friendly interface, faster notifications for fund openings, which I know lots of people will be excited about, and the option to receive fund opening alerts via text, email, and now also automated phone call. And you may be asking yourself, how do I get access to this? If you already have a FundFinder account, you're just going to use those same login credentials to access the updated site beginning on July 1. If you don't have an account, don't worry, it is free to sign up. You just need to head over to fundfinder.org today. Here is a quick sneak peek at the new FundFinder interface for those of you who are curious. We've got plans for additional enhancements in the coming months, so please stay tuned as FundFinder continues to add new functionality, including things like filters and more. We're really excited to keep providing this free tool to help connect you and your patients to the financial assistance resources they need to stay healthy and well. So we've covered a lot of content today. Here at the Patient Advocate Foundation, we want to make sure that you are set up for success when you access TotalAssist and all of our programs. So in addition to the full recording and today's slides, we're also going to set you up with some really helpful guides and additional resources. The first are 2 short checklist guides that are going to help you and your patients prepare for the launch of TotalAssist. Each guide covers key information or activities that you might need to complete before July 1. We'll share these with you after the presentation, but you can also access them anytime directly from this slide deck by clicking those bold and underlined hyperlinks you see here. We've also developed a comprehensive TotalAssist FAQ document, and it covers everything from eligibility and enrollment, legacy grants, claims, and more. You'll receive a link to this document in your follow-up email, and it will also be available for download beginning July 1 at TotalAssist.org. Finally, we did reference our TotalAssist claims guide several times in today's presentation. You learned that this lives 24/7 in our portal and can be downloaded right from the same page where you access your patient's pharmacy card in their application details. We're also going to include it with you for the follow-up email, but it will also be available at TotalAssist.org, so multiple places where you can access this really helpful resource. Finally, we offer on-demand training for all of our provider and pharmacy team members. Simply email providerhelp@patientadvocate.org to schedule a training for you and your team. We can cover everything from an overview of the Total Assist program to portal demonstrations and onboarding. We can also help you troubleshoot any issues and optimize your workflows. Again, to take advantage of this, just send us a quick email at the address listed here. All right, now that you're set with resources and support, I wanted to take a few minutes to remind you of our launch timeline. First, we have pre-launch. This is what's happening between today and July 1. Between today and Friday, June 26th, pardon me, current grants are going to continue without interruption. So that's all of those legacy grants from both the CPR program and the PAN Foundation Patient Assistance Program. Patients and providers can continue using your existing portals through June 26th at 5:30 p.m. Eastern. Most eligibility and those grant terms are going to continue to remain unchanged during this time, and during this period, new and returning patients can continue to apply for assistance through either program. However, starting June 7th through June 30th, we are going to have a downtime period. During this time, PAF CPR and PAN call centers plus the portals will be unavailable. Grant enrollments and re-enrollments are also unavailable during this time, so we really would encourage you before that June 26th deadline to make sure you're doing any work in those portals or giving us a call for any urgent matters before that deadline. All right. July 1 is our big day. Total Assist will launch, and all of our new grant applications are going to go through the United Total Assist program. On this day, legacy PAN grants will start to have that expanded coverage we talked about at our last webinar. That includes health insurance premiums, office visit copays the day of treatment, and treatment-related administration charges, in addition to those medication copays. All other legacy grant coverage is going to remain the same. On July 1, we're also going to be launching Total Assist United call centers. You can call us toll-free at 1-866-512-3861, and we've also included that fax number for Total Assist there as well. July 1 will be the launch date as well of all of our new portals that we cover. So provider portals and pharmacy portals, which we covered today, are launching alongside our patient and nonprofit portals. Remember, if you have a CPR portal account, you're just going to log in using those same credentials to access that new updated portal. If you have a PAN portal account, you're going to reset your password and use your same email as your original PAN program portal username. If you have both portals, you're going to use those CPR credentials to go ahead and log in. So no need to reset your password if you do have both portals. Finally, we're launching the TotalAssist.org website, and this is going to be where you go for portal access, our help center, our eligibility checker, and all of our fund opening resources. An additional note, all grant information and communications are also going to start to be branded under Total Assist starting July 1. So this includes legacy programs. So if your patients are enrolled in a legacy grant, all of the communications they receive from us will now be branded Total Assist. Just keep that in mind. That brings us to today's final portion of the webinar, our Q&A. Many of you have been submitting questions throughout today's presentation, and I know our team has been working fast and furiously behind the scenes to make sure we can answer as many questions as possible live. Many of you also submitted questions when you registered for today's event, so we've selected several of those questions that were frequently asked to cover today. The first question we'll take today is, what if only a health equity or a metastatic fund is opened? How does eligibility differ between those two funds? So this question is ultimately about different fund types. At Patient Advocate Foundation, we offer several fund types: general funds, health equity funds, and metastatic funds. And we're first going to look at those health equity funds first. Health equity funds have the same eligibility criteria as our general funds for the corresponding disease state. So the example here is a breast cancer grant and a breast cancer health equity grant are going to have that same basic criteria. The health equity fund has an extra additional requirement that the patient must reside in an eligible county that's covered by our health equity funds. Don't be confused though or worried. What we do is all patients that are automatically screened for health equity funds when they apply based on that the address that you place in for the application. So we automatically screen all patients for health equity fund eligibility. If your patient meet the additional criteria for either for the health equity fund, they're ultimately eligible for either fund, either the general fund or the health equity fund. An important note here that this is an either, not an and. So if both funds are open and your patient is eligible for both, they can only enroll in one fund of the same disease name. So keep that in mind. Metastatic funds is very similar. So metastatic, just like health equity, have the same eligibility criteria as the general funds for the corresponding disease state. In this example, we'll use breast cancer again. The breast cancer fund criteria is the same as the metastatic breast cancer fund, with one exception. The patient's disease stage has to be stage 4 in order to qualify for the metastatic breast cancer fund, and this has to be confirmed by their treating provider. But patients who meet this additional criteria are going to be eligible for either the metastatic fund or the regular breast cancer fund. So if both of those funds are open, you can make that selection. If only one is open, they would be eligible for either of those. So, all right, next. We have a question about a way to connect multiple providers from one organization and their patients across multiple portal users. So we know that lots of you use the portal across larger teams. So the short answer is yes, that you're going to be able to do that. In the Total Assist portal, patients are connected to providers and pharmacy user accounts via their NPI number. So to view and share patient information across multiple users, you're just going to have the same NPI number as your fellow users, and any associated patients are going to show up in that account. A quick note here is that all users in the Total Assist portal do have the same status. There is no administrator role. So every user has full functionality across all of the workflows that you saw today. All right, next question we have is, how will I be able to tell the difference between legacy PAN grants and Total Assist grants and CPR grants in the portal? So when you select full application details for any application in Total Assist, at the top of the screen, you're going to see an application reference number in that top left-hand corner. Total Assist grants are going to appear with an APPTAA for Total Assist. PAF CPR grants are going to appear with an APP-CPR before the number, and then finally PAN grants will begin with an APP-PAN. So that'll be your kind of visual cue to see what program the patient is currently enrolled in. When applying for one patient for multiple grants, will the patient's information pre-populate or transfer over? For existing patients, the good news is yes, some of that basic information is going to pre-populate from their previous applications. And this is the case whether you're renewing a grant or enrolling patients in multiple grants of different disease types. For example, the breast cancer grant we've been talking about so far, plus maybe an asthma grant if they meet the diagnostic and fund criteria for that fund. Please note that some of that information you are going to have to input. So that includes things like your diagnosis and then medications, ICD-10 codes, and more to complete the total application. All right. With that, we have come to the end of today's presentation. I want to thank you again to everyone that joined us today. We hope you found this information helpful and useful as we approach the launch of Total Assist on July 1. As always, we're really thankful and grateful for each and every one of you as for being a member of our community. Please be on the lookout for all of the resources, the slides, and the recording that we promised for you today. I hope everyone has a wonderful day.